let's go to our next guest, Susan Lang. Susan is founder and CEO of HooPayz, and Jonathan shared a little bit about her background earlier, which is quite impressive, having been previously in senior executive positions at other parts of this healthcare consumerism ecosystem, Express Scripts and BJC Healthcare and UMass Medical School. So we've got a real well-informed, highly experienced executive that will be joining us on the topic of financial wellness in healthcare. And it's one of those themes that people don't really think about until it's brought to their attention, how much pain is caused, not just from one's health itself, but from the financial implications. My understanding is that financial challenges, especially bankruptcy due to medical bills, is one of the key. Or let me put it this way: bankruptcy due to medical bills may be the number one reason for bankruptcy among individuals, and 80% of medical bills have errors. That will make my head explode when I get those bills, and it happens too often for me. So, survey of one, I understand the pain that causes, and there's tremendous waste in healthcare. So, what HooPayz has done is put together an organization that helps employers deliver financial wellness solutions to their employees when it comes to healthcare. So, Susan, thank you, and welcome to the show.
Thank you. It's great to be here.
Can you talk to us just, first of all, I hope Jonathan and I did justice to describing HooPayz. Do you want to take a crack at that yourself, or did we get it somewhat right?
Yeah, I thought you guys did a great job, and I appreciate Barry's comments. It's great to follow on the private exchanges, because we're a financial wellness company, so we try to save employers and consumers money on their health care costs, the actual cost of care, and we also want to reduce their stress and make sure they understand how to use their benefits. So we don't sell benefits. We come in once you have your benefits in place, but we absolutely believe that your employees and consumers need the right tools to make informed decisions that will reduce their out-of-pocket spend. We think that's absolutely critical. And to date, those tools have not been available, and now the market has really shifted. So we think this is a great time to start talking about financial wellness and what does this mean for your family and for your company.
Susan, when you think about your best clients for HooPayz and clients and prospects, and at two levels. One are the employers, and the other is, those taking up the service when it's offered, the employees. Who is your ideal client? Who understands and gets this first?
So, it's
is there
been
anything unique about those companies?
Yeah, it's not been what we thought it would be. So let me just say, as an entrepreneur starting a new company in a very fragmented healthcare environment with a lot of risk, we thought it would be self-funded employers, because for every dollar we can save their employee, that's a dollar back in the employer's pocket. But to some extent, it has been the fully funded sort of mid-sized employers that have said, we have to get ready for shifting more cost to our employees. We understand that they do not understand their benefits. Benefit literacy is really poor out in the marketplace. People don't understand what a deductible is versus their copay. So we've had a lot of fully funded employers who are getting ready to maybe move to an HSA, a health savings account, or move their deductible to a little bit higher deductible, come to us and say, let's have this discussion now with our employees. Let's start right away, because this is a behavior change that takes 2 to 3 years.
Right. So I was thinking about one of the things that the Institute for Healthcare Consumerism was founded on a number of years ago was this idea of the promises that healthcare consumerism could deliver. One of them was increased choice and control, and private exchanges certainly impact that. Another was catalyzing wellness, and improving care, and so on. But enhancing clarity, reducing complexity, and lowering cost are certainly at the top of that promise list. Can you share a little bit about your thoughts with where what state is the market in? What state of maturity is the market in with regard to enhancing clarity, reducing complexity, and then maybe, I'd be curious to hear about the features of your offering that enable that.
Sure. So that's a great question. Here's what I would tell you. I ran hospitals for about 18 years, and then I was on the corporate side with a large pharmacy benefit manager. Healthcare has about 9 trillion transactions a year. It's staggering when you think about it. And that takes care of over the continuum of both the medical benefit and the pharmacy benefit. So we don't see that the market is getting less complex for the consumer who's actually using their benefit. We actually think it's gotten more complex. And the way we would think about this is when we went from a pension plan to a 401k, and all of a sudden you're saying to your employees, okay, go out and invest your money, make sure that you're saving for your retirement. And folks really were confused about what to do, and that's what we're seeing with consumers today and employees today. So we think there's 3 keys to financial wellness. We think the first key is we've got to engage your employees. If they're not engaged in the cost of their care, you're going to force them to be engaged within the next 3 years because the cost curve is shifting and employers still need to be competitive. And that's, I think, a lot of the attraction of private exchanges. So we've got to get them engaged in understanding their benefit and how to use their benefit. The second issue is there's got to be price transparency. You have to be able to look at your network and say, if I want an MRI today of my knee, I can go to an in-network credentialed doctor and pay $200, or I could pay $2,500 without any difference in quality of care whatsoever. There has not been the ability to look at that cost and make an informed choice. So we think transparency is critical. And the last thing is you really need a personal advocate or a health advocate. We look at medical bills. We help people shop for care. We find people's benefits have been misapplied. There's enormous amount of waste and error in the healthcare system. We think healthcare is expensive enough. We don't want you to overpay. We think somebody actually has to help you navigate that. It's really difficult for you to do that on your own.
So how does that work on your service? Is each participant assigned an advocate, or is it just when people feel they have a need, they can call and get access to the advocate? Is it proactive or reactive for the the employee?
Right. So we have 2 levels of service. So the first, and it's bundled for the employer. So we have online transparency tools where you can actually, the member can go online, 3 seconds, look up their procedure in their zip code, and they will see paid claims data. They will see what the actual paid amount was for that procedure. We rank order the providers, and they can actually choose where to go. So they can actually go online. They can go on their mobile, use that service. We also have other tools on our website to manage your deductible, to manage your healthcare budget. We're finding more and more, particularly hospital outpatient services, are asking for 100% of your deductible up front. Because of the claims lag, even if you've already paid it, they're asking for you to pay it again, and then they'll refund it by the end of the year. We don't think you should have to pay that out of pocket. So you can go online, or if you want to check prices on a procedure, you can call us, and you'll have a personal advisor who will work with you. If you've got a medical bill that you're not sure how much you owe or if your benefit's been applied correctly, then we will actually call and we will review the bill. We also will renegotiate with your providers. One of the things we're seeing, Andrew and Jonathan, is we're seeing a lot of folks go to ERs, so they go to a hospital emergency room, but the doctor coverage is out of network, even though the hospital was in network. So we would take those bills and renegotiate a discount for that service.
That's great.
So it's a combination of some digital tools and high touch.
Boy, it's badly needed. So good for you. And let me ask you, though, tell us a little bit about how what you're offering coordinates with a wellness or a total rewards program. How do those fit together?
So that's a great question. So what we do, and it depends on the individual employer and their culture. So if you have a wellness program in place today that is a health wellness without a financial wellness component, then we will actually work on a custom incentive program for your members, and we will coordinate with your wellness vendor. So some companies do that with a point system. So you get so many points if you have your blood pressure checked, so many points if you do a health risk assessment. In our case, you would get so many points if you go to what we call a fairly priced provider. So we color code the providers, and our providers that are reasonably, what we consider reasonably priced versus very expensive for the same care. So we can coordinate through your wellness program, and we really think that this really reduces the stress of your employees and improves their productivity. If you're really worried about a procedure, a test you're going to have, you're not sure what you're going to have to pay when you go to that clinic or doctor's office, or you have a medical bill coming in because you have complex care. Let's just say you're getting care for cancer. You could be getting $30,000 worth of bills a month. If you're on the phone dealing with those providers in your health plan every day trying to figure out what's going on, it's terrible for the productivity for the employer. So we want to take that on. We want to make sure we can make those calls on your behalf, that you're not spending your time sitting on the phone, and that we're improving your stress level. That translates into higher employee satisfaction, and for our current clients, our employee satisfaction to date is 95%. So folks that use the service really love it and have had a great experience.
Well, so what other kinds of results are you seeing? And in terms of, especially in terms of financial results, what kind of results are you seeing, and are those results accruing to the employer, the employee, both? What does that look like?
So we are seeing an average of about $850 savings per personal advisor interaction, per engagement. The online tool, the cost savings tool, we see about a $600 savings per price check, what we call a price check. Some of those savings are accruing directly to the member because they're still in their deductible phase. However, this is how I would think about that. The longer you can keep your employee in that deductible phase, and it doesn't hit the first dollar out of pocket for the employer, the better that is for the employer also. So we think it's about a 60-40 split, 60% to the employee, 40% to the employer. That could change over time as more and more folks use the service. But right now we're having great savings results. And let me give you an example. We just had a client just a couple weeks ago. There was a 25-year-old employee's daughter, essentially. It was an employee's daughter who's 25 years old. Got into a situation out in a remote area, had to be air vaxxed to a Denver medical center. She ended up in the ER for 6 hours with a $48,000 bill. So part of that bill, right, and so they had a max out of pocket of $6,000. So a 25-year-old to pay $6,000 out of pocket, it was probably for this particular person a fourth of her salary. The rest gets picked up by her employer. We were able to look at that bill, review it. We realized there was $18,000 worth of facility fees on that bill, and have those removed. So we saved, not only did we save the employee, but then the employer did not pick up the rest of that cost. So there are true savings out there that nobody has been able to get to, that hasn't been efficient for large companies, where we think we can really have an impact.
That's really great. Well, I know we're running up against the end of our segment and our show, Susan. So I wonder if you could share some, top three, say, takeaways for our audience.
Sure. Here's what I would tell you: that healthcare prices, even within your network, are all over the place. Providers do not pay the same thing, so you've got to look at the cost of your care. We think financial wellness needs to be a core component of anybody offering an HSA or a high deductible or a consumer-directed plan. Absolutely, their employees need help. Consumers have to be able to make informed choices, which means they need tools and resources. And without the tools and resources, employers are going to continue to pay too much for bad decisions. I mean, I think, and mistakes that are in healthcare. So that's what I would leave you with. But again, great results out in the marketplace. We have really happy clients right now.
Well, that's great. Well, thank you so much for joining us today and for sharing your experiences and insights. And we look forward to connecting with you again soon.